Hello and welcome to episode 5 of ALIGNERCO's podcast. Today I'm joined by Dr Knight, who will be answering some of your frequently asked questions. Thank you for joining us, Dr Knight, and please introduce yourself to our listeners.
My name is Harlan Knight. I'm a 1991 graduate of the University of Alabama School of Dentistry. I had my own private practice from the time I graduated in about 26 years in North Alabama. And then I went into semi-retirement. I moved down to the Alabama coast and lived at the beach and practiced 2 or 3 more years till right before the time of COVID. And then I went into a kind of an advisory role. I worked as a clinical director for a large corporate dental practice, and they have multiple practices in states. So I'm their advisor and clinical director there because they needed someone that practiced as long as I have to help the younger doctors and then help them along, answer their questions, and make sure their clinical standards are met. So I've had a lot of experience in all phases of dentistry. I've done, endodontics, orthodontics. I've done just a little bit of everything, and it's been a good career. And I still stay active in dentistry and stay active with my colleagues and enjoy dentistry still, and enjoy teaching the younger dentists the things that I've learned. And it's been a good career, and it's been good to me, and it continues to be.
First question, what is the ideal age for someone to consider orthodontic treatment?
Well, I think it's always good when a child comes in and they start getting the adult dentition in, start seeing the first molars come in usually around the age of 6. And it's always good to evaluate them and also evaluate their growth and make sure their growth is within the charts of what we consider normal. As a general answer, usually about the age 7, when the first molars are well erupted, we can get a good idea if they're going to have any type.
Can adults benefit from orthodontic treatment, or is it just primarily children and teenagers?
Well, adults can absolutely benefit. There's many reasons for them to seek treatment, and one of the most common reasons to seek treatment is they'll have an orthodontic relapse as they get older. It's very common as you age for the teeth to move forward, and it usually creates crowding, especially in the lower arch, and you have a tendency for the teeth to go back where they were prior to treatment. So yes, adults benefit, and also you have issues sometimes with the bite that causes TMJ issues, and so there's a lot of things we can do. If you go into an orthodontic office, a lot of times you'll see just as many adults in there as you see children and see adolescents.
Are there alternatives to traditional braces, and how do you compare them in terms of effectiveness?
Well, yes, there's options that you have. We're a more cosmetic-minded society now. A lot of people, you don't want to be 25 years old. You don't be a senior in college and smile and have the traditional metal brackets. So we have the option, if traditional orthodontics is needed, we have an option of ceramic brackets. We have clear wires, and so it makes a much better case. And then of course the clear aligners that are available with a company like yours, like ALIGNERCO. We can do a lot more than we used to do it in a nice, pleasing, aesthetic manner. You can and having clear trays doesn't really interfere with anything in your life, and you can move forward. And so it just leaves options open for people other than someone who wants to be bound for metal wires and brackets for 36 months.
So do you find that a lot more people are opting for clear aligners because they are just a bit more convenient and pretty discreet?
Yes, I do, because when those options came available, a lot of marketing was done at first, and so especially in magazines, and so you see people are more aware, and then when you go into a private office or a private practice, it's something that on a daily basis, people ask you about that. So they're more aware now than they were, I say, a decade ago, and then the aesthetic demands, especially of teenagers and adults, they just do not want metal brackets anymore. So it's totally changed the way we do orthodontics.
How long does the average orthodontic treatment take?
Well, it just depends on the difficulty of the case. I mean, there's sometimes someone with really bad skeletal misalignment, sometimes it requires years. It can be in phases. It can be surgery. It could be then what we call a phase 1 treatment to kind of align the front teeth, and then you go and start making the final alignments. And then sometimes, like in a relapse case, which is most common that you use aligners for, is it can be as short as say 9 months, and then sometimes it could extend into a year and a half or even longer, depending on the complexity of the case. But the average relapse case that you see so commonly, usually it's anywhere between 9 months and a year.
Are there any specific foods or habits that patients should avoid during orthodontic treatment?
Well, yes, absolutely, especially during more traditional treatment modalities. When you're talking about wires and brackets, they always tell you to avoid sticky foods, hard foods, candy, biting into apples, because brackets that are bonded to the teeth, they have a tendency sometimes to pop off, and it's a real problem. But the great thing about aligners is not really, because you can remove the aligners when you eat. You can eat what you want to, and then you can absolutely practice better hygiene habits after that you eat, and keep and floss and do those things. So the limitations are obviously much less with aligner therapy, and that's one of the great advantages. You can take them out and eat your apple or eat your candy. So, doctor.
So what role does genetics play in the development of these orthodontic issues?
Well, genetics plays a big role, just like hair color or eye color or height. A lot of times, I've had patients say, I've got my mama's teeth and my mama has her teeth. So, especially in a lot of crowding issues and spacing, and you'll see sometimes missing teeth occur because it's carried down through genetics. So it plays a big role. And a lot of times those problems of malocclusion, they're repeated within the generations due to genetics.
And is it necessary to have teeth extracted before getting braces, or can all cases be treated without extractions?
Well, we have a tendency now to try to treat without extractions.
Okay.
Now, really severe crowding issues, sometimes you just can't avoid it, but the majority of cases are treated without extraction as non-extraction cases. Now, it was a tendency, say 20 years ago, to extract. And so it wasn't common to extract the premolar teeth prior to doing orthodontic treatment. And now you just don't see that as much. But it just depends on the severity. And if it's an average relapse case, which is the most common reason that we see in a dental office with adults, then 99% of the time there's no type of extractions needed.
How do orthodontists address issues like overbite, underbite, and crossbite?
Well, in a general practice, when you see these problems develop, it's usually a wise thing to go ahead and send the patient to an orthodontist and have a consultation done, and they'll use digital records of pictures and photographs, and they'll see what the extent of the malalignment is. They'll look at the relationship between the upper jaw and the lower jaw, which is very important to determining if the case is a surgical versus a non-surgical case. And if it is a surgical case, then the orthodontist will work with that oral surgeon to complete that phase, and then the orthodontist will begin their work. So it just, once again, that varies as well with the type of case that's been.
Yes. Can orthodontic treatment help with jaw pain or discomfort?
Oh yes, I mean, it's very common to see people that have jaw malalignment have TMJ problems, or temporal mandibular joint disorders, and it will eventually lead to arthritis in the joint, the breaking down of the cartilage in between the bone and in between the upper and lower jaw. So alignment of the teeth and correction of those severe bite issues will definitely relieve or relieve TMJ problems, and it's one of the first things that's considered for chronic patients.
Are there any long-term health benefits associated with having straight teeth?
Absolutely. Straight teeth are easy to clean. They're easy to floss. They're easy to brush. If teeth are malaligned and especially crowding or pushed toward the middle of the arch or pushed toward the tongue, they're very difficult for patients to get in there and adequately clean. And so you see much higher rates of periodontal disease and much higher rates of caries or decay with the crook teeth than you do with the teeth that have been straightened.
Tell us what the difference is between a dentist and an orthodontist, and then when they should see an orthodontist.
Well, a dentist basically helps you throughout your lifetime with overall general care. I mean, you go to the general dentist office to have your teeth clean, checked, of course, twice a year is what we recommend. When you have decay, cavities, periodontal disease, we're the one that treat it. We're also the first line in order to diagnose problems that are occurring where we see where orthodontic problems are going to develop. So, of course, orthodontists are specialists. They usually have additional training to general dentists, and they limit their practice to the straightening of the teeth. Now, over time, since aligner therapy has been developed, we have to send patients less and less to the orthodontic specialists. So mainly the ones we send to them are cases that sometimes will fall outside of what can be treated with clear aligners, which are not all that many. So most of the time, we can, general dentists can treat in-house, especially after adolescence, young adults and when the dentition is stable and their growth is finished, they're much easier to be handled within the general dentist office.
What advancements in orthodontic technology have had the most significant impact on the patient experience?
And the biggest advantage, of course, I keep hitting on the clear aligners, are that you can remove them. You don't have to worry about brackets breaking. Of course, the hygiene situation is much more improved with clear aligner therapy than it is with fixed therapy.
Thanks for joining us on episode 5 of ALIGNERCO's podcast with Dr. Harlan Knight. We hope you enjoyed and found this episode valuable. If you have any questions, please leave a comment below and we'll be sure to address them in our next episode. Bye for now.